A center specializing in treatment of obesity consists of professionals such as surgeon, physician, dietitian, psychologists, and specialist nurses who all come together to provide a holistic and joined-up care for each individual patient. It is imperative that patients attend such places for best results. Before we start, it's important to know how to diagnose obesity. There are two very important parameters. First is the body mass index. One seemingly overweight and the other more lean, and we are interested in knowing what is the excess fat that a person may carry. Weight alone will not do it, because the taller person will be penalized by sometimes having more weight. So how do we calculate body mass index? It is weight in kilogram divided by height in meters squared. It is important to point out that the body mass index is different for different ethnicity. White population of European extraction, the figures over here apply. For the South Asian population, these numbers would be less than what they appear over here. So between 18.5 and 25 are considered normal. BMI of 25 to 30 is overweight, and then this is the obesity level, the extreme being those with a BMI of greater than 40. The other parameter is the abdominal circumference. This is measured by using a tape measure that is non-distensible at the midway point between the navel or the umbilicus and the hip bone, as seen over here. And this is most useful for patients with a BMI of 25 to 35 because it indicates central obesity or visceral obesity, which is a high risk factor for complications, which I will explain later. So in white population, abdominal circumference or girth of 40 inches in males is associated with complications, and 35 inches in females. These numbers are significantly less for South Asians, where for males it is 35 inches and for females it is 30 inches. So the next step is what happens once a patient arrives at the specialist center, where they are usually treated by several specialists such as the surgeon, physician, psychologist, dietitian, and nursing support. The patients undergo a comprehensive assessment of their history, such as their medical history, their comorbidities, diabetes, hypertension, dyslipidemia. What attempts have they made to lose weight? Are they taking any medication that might affect their weight? And there could be several of these, such as hormones, antihypertensive medication, antipsychotic medication, those for gynecological conditions, whether or not they have any family history of obesity, diabetes, and cardiovascular disease. What about their social history? And what about their education, socioeconomic status, living situation, and tobacco and alcohol use, as I've said before. All of these factors have a big impact on patients. Once this process is complete, then the patients undergo an in-depth psychological assessment. This is perhaps just as important part, if not the most important part, in understanding obesity. Patients are screened for eating disorders, binge eating disorder, night eating syndrome, and their assessment is made of their emotional well-being. Patients are also assessed for anxiety, depression, or other mental health issues. All of these will have a huge impact on managing obesity going forward. Patients are specifically evaluated for coping mechanism with stress, etc. Then to determine their readiness to change and what is their motivation level to change. And then to identify potential barriers to treatment adherence. So if a treatment is prescribed, the professionals would wish to know whether or not the patients are able to adhere to that. The next stage is detailed nutrition and exercise evaluation. So patients are asked comprehensively about their food intake history, their 24-hour dietary recall or 3-day food diary, meal timing, snacking habits and triggers, food preferences, allergies and intolerances, and use of supplements or weight loss products. And then further detailed assessments are made of nutritional adequacy, exercise habits, preferences, and their limitations. Patients are asked about their sedentary behaviors and screen time, and then whether environmental factors that may influence their diet and exercise. It is absolutely crucial to have an in-depth assessment and understanding of all of these factors prior to taking the management or to suggesting any treatments. Once the history is complete, patients then undergo a comprehensive physical examination, the first of which is anthropometric examinations or measurements such as the height, weight, BMI, and abdominal circumference, which are the most important. Body composition such as fat percentage can be analyzed if those techniques are available. Vital signs such as heart rate, blood pressure are checked Cardiorespiratory and musculoskeletal assessment is made to see whether or not patients are capable of exercise and what is the duration that they may carry on certain activity. And then skin is examined for obesity related issues. Each patient will undergo specific laboratory tests, which will include blood tests such as a complete blood count to assess for a complete metabolic panel is performed to ensure that patients are not suffering from metabolic syndrome, which denotes a specific risk associated with several parameters coming together. Patients are checked for diabetes with glucose and hemoglobin A1C. A fasting lipid profile is performed to assess for dyslipidemia and high levels of cholesterol or lower density lipoproteins and triglycerides, and thyroid function tests is assessed. Urine analysis is performed, and then additional tests are performed based on risk factors for certain causes of obesity that I shall explain later. The teams specifically check for all other causes of obesity, and these may be lifestyle, psychological, psychiatric, socioeconomic, endocrine, neurological, genetic, and importantly also medication. This is only a brief list. The team will specifically look for all of these associated conditions of obesity which are either made worse by obesity or may directly be impacted by or develop as a result. These are typically cardiovascular, such as dyslipidemia, coronary artery disease, risk of stroke and venous thromboembolism, psychological, such as stigma, depression, dementia. In the GI tract, gallstones are more common, and reflux of acid into the gullet may happen. Gynecological, especially in patients with excess obesity, there could be infertility, abnormal uterine bleeding, cycles without ovulation, endometriosis, higher risk of uterine malignancy, sexual dysfunction, and then specific conditions related to pregnancy, which poses a much higher risk. Obesity is related to a high risk of cancer, and the latest figures from the US show that up to 40% of the cancers obesity was implicated in some way. This could be the GI tract, such as the liver, pancreas, bowel, colon, breast, and several other body systems. In the respiratory tract, obesity is associated with obstructive sleep apnea, asthma, and obesity-related difficulty in taking a full breath, such as called obesity hypoventilation. Infections such as flu and COVID-19 have been demonstrated to impact the obese much more severely. Within the urinary tract, kidney failure is more common in patients with obesity, as well as the kidney stones. Once all of this information is collated, understood, a treatment plan may be formulated. This will be multidisciplinary team collaboration, bringing in all of the strands, such as the medical specialist, the psychologist, the dietitian, specialist nurse, and other specialties as needed. Each individual risk factors is assessed, and a tailored strategy is then developed that could either be a medical nutrition therapy, exercise prescription, cognitive behavioral therapy, pharmacotherapy, that is with medication, or evaluation for surgery if required. Once treatment starts, this is when the real hard work begins to be able to regularly follow and monitor these patients up, tracking their weight and other health markers, and assessing their adherence to the prescribed treatment, as well as addressing any barriers that the patients may face. As time goes on, these treatment plans may have to be adjusted so that optimal results can be achieved. Going back to the original question of just shopping for a surgical procedure to reduce weight can at times be difficult to manage, and it may sometimes backfire spectacularly if there is no team to catch the patients when things don't go to plan. So in conclusion, I cannot stress enough the importance of comprehensive initial assessment, personalized treatment for greater success, and the role of specialist centers in the management of obesity. This completes this video. If you have any comments, please do share.